quickly review how to interpret spirometry reports. This is something that's come up a couple times in the last few weeks, and it's, I think, helpful to be able to interpret these quickly so that we can arrive at a correct assessment and then recommend appropriate treatment. So this is an actual report from the Welch-Allyn machine that we have at the clinic. At the very top, like the EKG reports, it will tell you whether it's normal or abnormal. So on some level, that's helpful. If it's abnormal, it gives you a little bit of information, but we also want to be able to interpret these things ourselves and not just rely on what this machine is telling us. So let's zoom in a little bit here. The three parameters that are at the top of this table, I think, are the most important ones. There's 6 in all, but it's the FVC, the FEV1, and the FEV1 over FVC that I think are the most important for us to focus on. And just by way of review, the FVC is, the FVC is that volume of air that you expire after a maximal inspiration, and it's measured in units of liters, its volume. Forced expiratory volume in 1 second is also measured in liters, and it's that volume that's expired in the first second after a maximal inspiration and expiration. And then the forced expiratory volume in 1 second divided by the FVC is basically the percentage of expired air that comes out in the first second. So now that we understand those, let's just take a look here. This has a predicted column. So these are predicted values, kind of like peak flow readings. They're based on the patient's height, weight, and age and gender. And then here is the best effort. You'll see that there were 3 efforts over here, and this is the best effort. Also, like peak flow, we take the best effort instead of the average. Sometimes people get confused about that, but we definitely want to take the best effort. And then this is the percent of the predicted value. So 4.61 liters is greater than 4.48 liters. And so this is 103%. Does that make sense? So each of these 3 is actually greater than the predicted value. And so right there you might conclude that this is a normal reading because it's within the normal range. So what does that mean? There's a document from the Journal of the American Family Physician. I think you can get this on MD Consult. I'm also happy to email it to you. But it's pretty useful in terms of helping to understand how to interpret spirometry. This is a table that has the normal values. And so if we look at FVC, normal is between 80 and 120%. On that last table that we looked at in that report, the patient's was 104, so that's clearly within the normal range. The FEV1 was 103%, so that's also in the normal range. Notice that these have the same normal range, so it's easier to remember, 80 to 120. And then this third parameter, the FEV1 divided by FVC, this says within 5% of the predicted ratio. And so if we go back to this is 102%, which is really 2%, which is within 5%. So 74 is within 5% of 73, if that makes sense to you. And we're going to see a little bit later that there's actually a different way to use this particular parameter other than that within 5% guideline that I just showed you. Okay, so this is a normal report, normal spirometry. Let's look at one that is not normal. That's not the one I want. That's not the one I want. This is the one I want. Okay, so this is another report. This is a abnormal report, obviously. It says that right there. Again, here are the 3 parameters that we care about. And you'll see that the FVC is 66%. We said that the normal range was 80 to 120, so this is below the normal range. FEV1 is 77%. The same reference range here. This is below 80%, so that's also abnormal. And then the FEV1 over FVC, there's a 16% difference between the best effort and predicted, which is greater than the 5% difference that they quote in that table. So this clearly looks like an abnormal report in all three of these parameters. This same document has a pretty helpful algorithm down here at the bottom. And so it's pretty helpful to understand that if it's going to be either normal or abnormal. And if it's abnormal, you're looking to see whether it's a restrictive process or an obstructive process. And these three parameters are the ones that are going to help us understand that. So if we go back to this table from the abnormal report, and we put it, let's say, right here, we'll start. So we know the FVC is not normal, the FEV1 is not normal, and the absolute ratio is not normal. So we know we have an abnormal spirometry report here. The question is it obstructive or is it restrictive? So in an obstructive disease, the FVC may be normal or decreased, and here it is decreased. The FE1 is decreased. Here the FEV1 is also decreased. And then the absolute ratio is less than 70%. And here this is actually greater than 70%. So it doesn't look like it's obstructive. If we look at the restrictive pattern, the FVC is decreased. Again, it's decreased. FEV1 is decreased or normal. As we said before, it's decreased. And then the ratio here is greater than 70%. And here 116 is obviously greater than 70. And so this looks to be a restrictive pattern. If we go further in this document, there's a few things I wanted to point out. It's probably best at this point to start here. So when the FVC and the FEV1 are decreased, as they were in this patient, the distinction between an obstructive and restrictive ventilatory pattern basically you look at the FEV1 FVC ratio if they're both decreased. And if the ratio is normal or increased, it's a restrictive pattern. And if it's decreased, it's an obstructive pattern. So just to make this clear, because I may have lost you there when I lost myself, in both scenarios, obstructive and restrictive, the FVC and the FEV1 may be decreased. And if that's the case, you look at the ratio of the two, or the percentage, to help you figure it out. And if it's greater than 70, then it appears to be a restrictive pattern. If it's less than 70, it appears to be an obstructive pattern. To make a definitive diagnosis of restrictive lung disease, however, the patient should be referred to a pulmonary laboratory for static lung volumes. So if this is less than 70, like I said before, it indicates a restrictive ventilatory pattern, and then you administer a bronchodilator, and after that you repeat spirometry. The test is positive if the FEV1 increases by 12% and the FVC increases by at least 200 milliliters. That's what you need for the diagnosis of asthma right there, or COPD. So it's not, just to be clear, for that diagnosis we don't use peak flow, we use spirometry. And you have a pattern that looks obstructive, you give a bronchodilator, and then it responds so that the FEV1 increases by at least 12% and the FVC increases by 200 mLs. Okay, I guess the last thing I just wanted to mention about this was you need at least 3 acceptable spirograms or spirograms. And in each test, the patient should exhale for 6 seconds and then stop for a second or so before they start to inhale. So this may have been confusing. This was the first time I've done something like this. I'd love to get your feedback to find out if this was helpful. All right, see ya.